How's it going, guys? Today we're going to talk about 3 lifting techniques that will greatly positively influence and if you have any knee pain or back pain while lifting or moving things around. It's very common that people not only feel pain by the end of the day when they're working, but can eventually have pain longer term after years and years of lifting or working in any type of warehouses or anywhere where you have to move stuff around, even just working in an office and just having to move boxes around. Eventually, over time and repetitive use, that could eventually create pain in the long term in either your back or your knees. So the first thing I'm going to talk about is very common. I'm sure anytime you've ever been to any type of physical therapy or chiropractic, anyone will tell you the basics of lifting, which would be instead of bending over or instead of shifting your knees way past your toes, you want to actually just get into a squat, be able to lift it up with the squat, and placing it back down the same way. Of course, when we bend over, that puts a lot of strain and extra torque on your back, and that's going to put that extra pain or give you pain long term and extra issues. Where in terms of the knees, when you shift your knees past your toes, a lot of times what will happen is you would put that extra strain on the ligament inside your knee or on the meniscus inside your knee, and then you put that weight on that soft tissue to kind of be able to hold you up, and that's what creates meniscal issues long term. When you sit back in a squat, you lift it up this way, there's typically no pain. The hip, which is most capable of being able to move things around, is going to be your main mover. So I'm sure a lot of you guys have heard that. Now, when we get into more specifics, this is some key things that you probably haven't heard in your typical healthcare setting. So the second thing is, what if you have to, once you lift it, you have to move it around somewhere and bring it somewhere? Well, it's very common once someone picks it up, they think they did it right. So then they shift it backwards, they hold it against their body, and then they put all this pressure down against their back and against their spine, forcing their lower spine to protrude forward and the thoracic spine segments to protrude just a little bit backwards. Now we're talking about minute millimeters, but that difference will be all you need to do to keep your butt, to make your body less stable over time. So instead of keeping this unstable position for your back, if we're going to walk it, you want to keep your shoulders back instead of forward. That'll allow you to, instead of needing to extend through your lower back, you're able to extend through your mid back, and then you counter that with a neutral pelvic tilt here. So now we have shoulders back, neutral pelvis. So now we have a stable spine as we walk, instead of bending your back and shifting your arms forward, which then requires that overextension. Once you have that stable position, you're able to walk around, and now you keep the stable position not only during the lifting part, but also when you need to travel from spot to spot. Now, third and key, we're going to go over here. I'm going to teach you another strategy called the hip shift. So when you have, like, say we're talking about conveyor belts, something like that, or anytime where you need to move an object, especially a heavy object, from one spot to another, the hip shift is going to be the key. Because again, in order to save your back and you save your knees, the middle point that's going to protect that is the mobility and strength in your hip. The hip's what's going to save your knees and your back. So we're going to lift it again. We're going to come on over here. So say we have 2 conveyor belts here, and we need to shift, we need to bring objects from one to the other. So, and that was kind of a little bit of a lunge technique that you can always kind of do as well. Notice how, say I need to bring it from one spot to the other, most people would bend, lift, bend, crucifying their back, forcing not just now this heavy weight from having to lift it up in a bent position, but also having to twist at the same time, forcing an extra amount of basically unwanted twisting of the back. This is where the hip shift comes in handy, where you're going to shift to one side, shift to the other, to bring objects from one side to the next. So say I'm lifting it from this side over, it's the hip that's going to bring everything over, my back again stays stable. And this is the hip shift, which is going to put all your pressure into your hips, which is going to strengthen and keep your hips flexible, which will greatly save your knees and your back. For any other hints or questions, any other advice like this, by all means, ask any questions in the comments down below. If you want to learn anything else, by all means, reach out. And if you like this video and you like this kind of content, hit a thumbs up, and wait for you all next time. Thank you.